Does your child have constipation and you're concerned maybe something more serious is going on? In today's episode, we're going to talk all about the red flag symptoms for constipation and what leads me to the diagnosis of functional constipation.
Welcome to the Beehive Doctalks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Welcome back to Beehive Pediatrics. For those of you who are new to the show, my name is Dr. Blair Rolnick. I'm a board-certified pediatrician and mom myself. Today, I want to talk about one of the most common reasons that I see patients here in my practice, and that is for concerns about constipation. In today's episode, we're going to talk all about how I make the diagnosis and what leads me to think about a diagnosis of what's called functional constipation, and signs and symptoms that make me concerned for maybe potentially a more serious or potentially another diagnosis that is causing constipation. So let's start off by talking about how do you know when it is constipation and not something more serious? When I say constipation, I'm really referencing functional constipation, which means constipation without a medical cause. And when I talk about constipation, I really mean something that involves a hard stool that is difficult or painful to pass. And the reason that I get so specific is because I'll give you an example of a case that is not constipation. So often, parents of infants will come in and express concern to me about their infant grunting or turning red or seeming in distress and then passing a nice, soft, normal stool. This is actually called infant dyschezia. It's very normal. It typically appears around 4 to 6 weeks. And is technically not constipation because, again, the child is passing a nice, soft stool without any difficulty. We believe infant dyschezia actually is a process in which some infants are learning how to pass a stool, and it's generally harmless. So let's dive back in and talk a little bit more about constipation. Approximately 1/3 of children will have constipation at some point. And so, again, it's one of the most common reasons that parents come into my office with an acute concern. There are times classically when a child is at higher risk for constipation, and so that can also help clue me into a diagnosis potentially. So those times are introduction of solids for sure. So when I talk about introduction to solids in that 4 and again at that 6-month visit, one of the things I've warned parents about is you may see constipation rear up at this point. Why is that? Because your child has been eating the same diet for 4 to 6 months. And popular first solid foods like rice, bananas are extremely constipating. And so that's a time typically when I counsel patients and parents to be on the lookout for signs of constipation because you want to treat constipation early. The earlier you treat it, the easier it is to treat. And we'll talk about that later on. 2, when your child is getting ready or starting to think about toilet training. So again, this is usually part of the preventative guidance I give parents when we talk about potty training, to be on the lookout for signs of constipation and address them early. 3, when children start going to school. Most children find going to the bathroom in front of their peers or a shared bathroom to be a little bit of a scary experience, or they might be nervous about using a bathroom that isn't the same bathroom they typically use at home, or when there's been any change in the child's home environment. So a new babysitter, moving, a new school, a new baby in the household. Any changes in their home situation can cause a constipation flare. And 5, big changes in the diet, especially if your child is suddenly consuming a lot more cow's milk. That can be a big trigger for constipation. So let's address right off the bat some of them, what I call red flag symptoms. These are signs that are concerning that maybe something else is going on that is not functional constipation. So the first is if a child has not passed meconium, that's that first thick black tarry stool, within the first 48 hours of life. The second question I usually ask is the symptom onset. So if a patient is presenting with signs and symptoms of constipation and they're less than a month old, or even less than 2 months old, that is a concerning sign for me that potentially something else is going on. 3, if your child is having severe abdominal distension or recurrent episodes of vomiting, or this is their first episode of constipation and it's accompanied by abdominal distension and vomiting. 4, bloody stools or bloody vomiting. 5, if they're vomiting and that vomit is like a dark green color, actually kind of like this color right here in my logo, that's concerning for what's called bilious emesis, which is again concerning for something more serious going on. 6, if there's a family history of something called Hirschsprung's disease. 7, if there's failure to thrive, meaning your child is not meeting their normal growth parameters for height or weight or head circumference. 8, I like to take a look at the lower back. If there's anything midline, like a dimple, a cleft of hair over the lower back, that can be a sign that potentially something else is going on. 9, if there's any weakness in the lower extremities or any signs of gross motor or fine motor delay. If the constipation is acute and is occurring with other systemic signs of illness, fevers, mouth sores, joint pain, rash, or even if the constipation is chronic and now there are new systemic illness signs like, again, fever, especially mouth sores, joint pain, and rash, that can be concerning for other disease pathology such as IBD. 11, urinary incontinence. So if the constipation is accompanied by not urinating for 24 hours or 12 hours or even longer. 12, if there's any weight loss. 13, if there's any pencil-like stools, so if that stool is constantly coming out in a thin pencil-like smear. 14, if the constipation is persistent despite really appropriate management by the family, that usually raises a little bit of a red flag for me. So now let's say we've gone through all this checklist of 14 things and everything is no. Then I move on to thinking about making a diagnosis of what's called functional constipation. And this diagnosis is really made by taking a really thorough history by a physician. First, I usually recommend assessing the consistency and frequency of the stools. And this is really, I believe, best done with something called the Bristol stool chart. So I show all of my patients a picture of this chart over here, and I ask them to score their poop. So if their poop is looking more like type 1 or type 2, that is really consistent with constipation. Depending on the child's age, I may ask about signs of withholding. So that can look like smears of stool in the diaper or underwear, dancing or standing up on their tippy toes during a bowel movement, symptoms of things like abdominal pain, nausea, reduced appetite. They may actually complain of this pain while passing stools or have fecal or urinary incontinence. For infants, I actually like to specifically ask about the formula preparation, especially in this day and age. There are a couple devices out there that mix the formula for you. And so I like to be really specific about making sure that formula ratio is appropriate because improper preparation of formula may cause new onset constipation. Then I like to take a really good look at the patient's growth curves and make sure that they are maintaining or staying on their curve for weight, height, and head circumference. If they are younger, I like to take a really good look or a good history at their developmental milestones and making sure that those, specifically those motor milestones, are appropriate. After I've done all of that and taken a really thorough history, sometimes I kind of bring up the diagnostic criteria for constipation. So that usually includes having at least 2 criteria present for at least 2 weeks. Those are going to be 1, less than 2 defecations per week, so less than 2 bowel movements per week, at least 1 episode of incontinence per week after having been toilet trained, a history of stool retention, a history of pain or hard full bowel movements, the presence of large bowel movements, especially bowel movements that may obstruct the toilet in the past. So any 2 of those for at least 2 weeks, plus the other historical factors I mentioned, kind of clue me into the diagnosis of functional constipation. A lot of parents ask me about potentially the use of xray to help diagnose constipation, and there's really no evidence for the use of abdominal xray in the diagnosis specifically of functional constipation. It may be used when the diagnosis is unclear or there is another indication for an abdominal xray in your physician's opinion, such as potentially abdominal distension or vomiting. So we talked a little bit today about what clues make me think about a child potentially having the diagnosis of functional constipation and signs and symptoms that make me concerned that maybe something else is going on. On next week's episode, we're going to talk all about the treatment for constipation. I hope you found this episode helpful. If you have any questions or concerns, as always, please leave them below.
Thank you for watching the Beehive Doctalks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.